It is celebrated on the second Thursday of every March every year. The theme this year is Living with Kidney Disease, Kidney Health for Everyone Everywhere. In this, there are four components. First is effective symptom management, second is patient empowerment, third is life participation, and fourth is kidney care communities formation. Going into detail, empowerment is about shared decision making and self management. In shared decision making, the hospital, doctors, the team of doctors, dietitian, social worker, all this help the patient in taking various decisions about the disease itself, the future of the disease, and life paths. The second is self-management. In this, the patient has various electronic gadgets at home, including blood pressure monitors, sugar monitors, and these are connected to the doctor and the hospital network wirelessly, and this helps the patient in taking a self-management treatment at home itself, rather than going every time to the hospital for blood tests and for showing to the doctor. This has been found to be effective. The second is partnership. In this, the patient and the caregiver give policy settings so that interventions can be done by the hospital and the clinics and the doctor team, so that the visit of the patient to the hospital is easier and patient friendly. So the second part in this is communication, in which regular communications are given wirelessly to the patient either by SMS or by email or by a WhatsApp or other messages. In this, the patient comes to know when is the next visit to the hospital, when is the next blood test, which is etc. The next part in the World Kidney Day thing, strength based approach. In this, we see the patient resilience. How good is the patient in managing himself? Social connections. Whether the patient would be able to reach alone to the hospital or not is also a big question mark for patients who are not in good health. Then the knowledge of the disease. There are many patients who do not understand that they are having a permanent kidney problem or dialysis is going to be lifelong. So the knowledge of that is very important to be given to the patient. Access to support, social support, medical social worker support is an integral part of any hospital setting nowadays, and this has to be told to the patient and the caregiver relative, the help of these people. So access to support and to financial help also from various donor organizations is also very important for kidney patients, because it is a lifelong disease. The financial health of the patient is down. The next part would be self-management. Whatever is possible by the patient to be a self-reliant person, whether their job is ongoing or not, whether they are able to live with the family as a constructive member, the work in the kitchen, the work in the job, all these are important things so that they feel that they are an accepted part of the community. A very important part in the World Kidney Day nowadays is 2021 is that we should focus not on the disease but on the patient itself. So there is something called as symptom management. In this, the other aspects of the problems of the patient, that is pain, sleep deprivation, anxiety, depression, stress, mobility, and frailty issues of the patient are something which has to be looked after. There may be a wheelchair patient and the dialysis unit may be having stairs. So the hospital will have to construct a ramp so that the patient who is possibly having a motorized wheelchair can climb on the ramp and reach the hospital without any help from anybody. Also, there may be an availability of electronic taxis which will have a ramp, and the wheelchair patient can directly go along with the wheelchair into the taxi and reach the dialysis unit or vice versa to home if required. So World Kidney Day is about kidney health for everyone everywhere, and the theme this year in 2021 for World Kidney Day is Living Well with Kidney Disease. Thank you.